Hi Professor, my name is Taranpreet Kaur. My student ID is 153945225. I'm going to continue with my head to toe examination, and here is a 360 view of my room. Okay, the privacy has been provided, the hand hygiene performed, and good morning, my name is Taranpreet Kaur. I'm your student nurse today. As I reviewed the doctor's prescription, he ordered to perform a head to toe examination. Is that okay for you? May I know your name, please?
Navneet Kaur,
And your date of birth?
14 July
Can I see your date
1999.
of ID van? Patient is verified with the two identifiers. Now I will continue with the neurological examination. For that, I'll ask you some questions. You know where are you sitting right now?
At hospital.
And what's the time? It's around
5 o'clock in the
yeah,
evening.
yes. And can you tell me the name of the President of Canada?
Justin Trudeau.
Yes, thank you. The patient is well oriented to time, place, and persons. Now I will start to assess the parla. For that, I will check the director response, in which I will shine light in the right eye and check the pupil size in the same eye. We'll repeat same on the other side. Now for the consensual response, I will shine light in the right side and check the pupil of the opposite eye. We'll repeat the same on the other. And for the accommodations, keep focusing at the tip of the pen while as I will move it closer to you. Keep focusing. Yes. The pupil is equally round and reactive to light and accommodation. So now I will continue with the facial. I will check for the facial dropping, slurred speech, and the pronator drift. For the facial dropping, can you please smile for me and raise your eyebrows, clench your teeth. Okay, thank you. There is no sign of facial dropping. Now for the slurred speech, please repeat some words after me. Tip top, thanks, dynamite. Okay, as we saw, there is no stammering and slurred speech observed. For the pronator drift, can you please stand up for me and raise your hands at the chest level, close your eyes and count for 10.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
As we saw, there is no dropping of any arms. The pronator drift is negative. Next, we will move to the respiratory system. For that, firstly, I will inspect the chest anteriorly and posteriorly. As there is no signs of lesion, wounds, any kind of masses, the patient is breathing normally, which is non-labored, and no use of accessory muscles. So now I'm going to auscultate the chest anteriorly and posteriorly. There are 10 light marks anteriorly and 12 posteriorly. We'll start from the apex of the lung. Keep deep breathing in and out. Okay, can you sit there? I will auscultate it posteriorly. While auscultating, we haven't heard any kind of adventition sounds, no crackles, no wheezings, no stirrers was heard. And now I will inspect the posterior chest wall for expansion and restriction. For that, I will place my hand at the lower aspects of the lungs. Can you take deep breath in and out? As we can see, our hands are moving symmetrically. It means chest wall posteriorly is expanding symmetrically. So can you please sit back? Thank you. So now I will continue with the cardiac assessment. For that, I will landmark the heart valves. Here is the aortic valve, which is at the second intercostal space, right to the sternal border. Pulmonic valve, second intercostal space, left to the sternal border. Pulse point, third intercostal space, left to the sternal border. Tricuspid valve, fourth intercostal space left of the sternum, and the mitral valve, which is at the mid clavicle line. Here I will count the apical pulse for 30 seconds. Start. The rate is 80 beats per minute and it is regular. The strength is +2, and while auscultating the heart sounds, I hear the normal S1 and S2 sounds. There are no extra sounds and murmurs here while auscultating the hearts. So next we will move to the abdominal examinations. For that, can you please lie down? Thank you. Firstly, I will contour the abdominal, check for the contour. The abdomen is flat, there is no abdominal distension. Now I will auscultate the four quadrant. First we'll start from the right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. Vowel sounds are present and that are normal active. Now I will palpate her abdomen. If you feel any kind of pain, just let me know. Did you feel any pain? While palpating, the abdomen is firm. There is no rigidity, tenderness, masses and nodules. Any signs of herniations are observed. So now I will continue with the extremity and the integumentary assessment. For that I will check his skin, which is feeling warm bilaterally from both upper and lower extremities. Now I'll check her any deformity. Can you flex your both arms? Extend. Can I see your bony prominence at both sides? The heels. There is no bone, no redness or ulcer seen at the bone prominence, which means there is no signs of pressure injuries. That was as known sign of the diabetic foot on the feet. Now I will assess for the skin turgor. For that, I am pinching her skin, which is going back to the normal within 2 seconds, which means the patient is well hydrated. Now I am going to check for her nails. Her nails are very firm, soft and clean, and there is no clubbing of the nails. Now I will check for the capillary refill time. For that I am pressing the nail beds and the blood is gushing back within the 2 seconds, which means the capillary refill time is the normal. So now I'm going to palpate the carotid pulse, which is next to the trachea, medial to the sternomastoid muscles, which is palpable. Next we'll check the dorsalis pedalis pulse, which is at the top of the foot at the extender, halluceus tendons, palpable, equal bilaterally. Next is the posterior tibial pulse, just behind the medial malleolus. The pulses are regular and equal bilaterally. Can you please sit back for me? Now I will continue with the muscle strength. And for the muscle strength, can you please place your hands like this and push against me? Pull. Squeeze my hands as much you can. And we will check the muscle strengths in the lower extremities. Extend your legs. No flex. The muscle strength is good and it is 5 out of 5, and it is all about head to toe examinations. And here is a 360 view of my room. Thank you.